What is gastric motility testing? Have you ever wondered how your body moves food from your stomach into your intestines? Gastric motility testing is a procedure that helps us understand this process better. It is especially important for those dealing with sensitive stomach issues like irritable bowel syndrome and colitis. When the muscles in your digestive tract do not work properly, it can lead to discomfort and other symptoms. Gastric motility refers to the movement of food through your digestive system. This movement is essential for breaking down food and absorbing nutrients. If this process is disrupted, you might experience nausea, bloating, or abdominal pain. These symptoms are often seen in conditions like irritable bowel syndrome and colitis. There are several types of gastric motility tests. One common test is the gastric emptying test. In this test, you eat a meal that contains a small amount of radioactive material. After eating, imaging tests track how quickly the food leaves your stomach. This can help identify conditions like gastroparesis, where food takes too long to move from the stomach to the intestines. Another type of test is called manometry. This involves inserting a thin tube with pressure sensors into your digestive tract. It measures how well the muscles contract and push food along. While this test is often used for the esophagus, it can also be used for other areas of the gastrointestinal tract. There is also a small bowel motility test. This test focuses specifically on the small intestine and helps diagnose issues with how food moves through that part of your digestive system. For individuals with sensitive stomachs, gastric motility testing can pinpoint specific problems that may worsen their symptoms. If food is not moving correctly, it can create pressure and discomfort, making symptoms of irritable bowel syndrome or colitis worse. Endoscopy is another important tool in digestive health. It allows doctors to visually examine the inside of your digestive tract. While its main purpose is to look for structural issues like inflammation or blockages, it can sometimes be used alongside motility tests. For example, an endoscope may help position the catheter correctly during certain motility tests. Understanding gastric motility is essential for those with sensitive stomachs. If motility is impaired, it can lead to bloating or discomfort after meals. Identifying and addressing these motility issues can play a key role in managing conditions like irritable bowel syndrome and colitis effectively.